Hi, today we're going to be doing a thorax and lung assessment. So the first thing that I would do is I would check the patient's chart, and then I would perform hand hygiene, and I would enter the room and give the patient some privacy. Next, I would introduce myself to the patient. Hi, I'm Frank. I'm going to be your student nurse today. Could I have your name and your birthday, please?
My name is Brian LeBeau. I was born January 14th, 2000.
Excellent, Brian. So Brian, today you came in for a lung and thorax assessment. Is that correct?
Yes.
Okay. So Brian, with that, we're going to be asking you some questions, and I just need you to give me some honest answers back for that. Along with this, at some point I'm going to have to have you remove your shirt, and I'll be using my hands to palpate around. I'm just feeling for tenderness and soreness, any sounds that I can pick up while I'm pressing. Also, I'll be using a stethoscope to listen to your lungs. Is that going to be all right with you today?
Yes.
Okay, good. So at this point, I would start asking some some subjective questions. So Brian, I would like to know, have you ever had a past history of any sicknesses in your lungs? And what I mean is, have you ever had pneumonia or bronchitis or anything like this?
No.
Anything that maybe your doctor gave you an inhaler for or something like that? No? Well, that's good. Have you had any traumas or accidents recently or in the past? Any car accidents or maybe football injuries that related to the chest, or flipped over on your skateboard or bike, anything like that?
No.
Okay. Have you ever had any surgeries to your chest?
No.
No? Okay, those are all good answers, Brian. Have you ever been a smoker?
No.
Okay. Do you currently smoke now?
No.
No? Okay. Are you in an environment perhaps that smoking takes place? So you'd be, have you ever heard of secondhand smoke?
Yeah.
Okay, so that's what that would be like if anybody around you had smoked, secondhand smoke.
No.
That's good. And smoking includes cigars, cigarettes, marijuana, anything that you can smoke.
No.
Okay, that's good, Brian. Have you ever experienced any shortness of breath, perhaps like during exercise or running long runs, or PE class, anything like that? Something that would cause you like a burning sensation in the chest?
No.
Okay, all right. Do you currently exercise?
Yeah.
You do. Okay, good. What kind of exercises do you do?
Well, after school I come home and I work out.
What kind of exercises are that, Brian?
Just squats and push-ups, sit-ups.
Okay, some curls, benches,
yeah.
stuff. Okay, so light weightlifting or heavy
Yeah.
weightlifting? Or...
Well, just kind of in between,
Oh, okay, good. Do you do any running, any cardio?
A little bit, yeah.
You do? Okay, that's good. Now, when you're doing any of those activities, have you ever noticed any burning sensation, any coughing or anything like that?
No.
Okay, good. So at this point, if my patient had said, yes, that I do cough, or I have a cough going on right now, I would ask how long the cough has been. I would want to start asking questions about that, finding out what type of cough is it. Is it a wet cough? Is it a hoarse cough? Is it a dry cough? Is he coughing anything out? If so, what does it look like? I'd want to know what some of those answers are, so we could get a better idea of what's going on with him right now. So we addressed like some self-care behaviors and stuff like that. So you said that you do work out, and you do light workouts, and that you do run. Now, when you run, is it just around the block? Or do you do long runs?
Tend to be long runs, like
Long
5Ks.
5Ks. Do you do those often, or
Every once in a while.
every once in a while? And again, you said that you don't get any coughing or anything. Okay, so we want to reiterate some of those kinds of questions, because I'm only going to ask them a couple of times, but what I want to do is see if I'm getting the same answers from him. I know it might be annoying to a patient, but we've all been in that situation where they've asked us a question, they come back to it and asked us again. So that's just getting a solid foundation of what's really going on. So Brian, at this time, what I'm going to have you do is I would have you go ahead and remove your shirt, and then we're going to begin like with a physical assessment on you, okay? So go ahead and take a moment if you need. You ready?
Yeah.
Okay. So the first thing that I'm going to want to do is I'm going to take a look at the patient's body. I want to see if he's symmetrical. So what I'm looking for is everything overall. I want to make sure his overall posture is good. What I'm looking to see is he sloping? Maybe there's a reason for it. Maybe he's got some kyphosis or something going on. But overall, his posture looks good. I can see that he's symmetrical. As I come down through the chest, he's symmetrical. Down through the waist, I can see he's symmetrical all the way around. Go ahead and turn around, and we'll take a look at your back. Again, I can see he's symmetrical. His clavicle was good up here. He's got a straight line down his back. I can see his C7 right there. That's good. His scapulas are symmetrical in the same place. That's excellent, Brian. Go ahead and turn around. So at this point, I would want to feel for temperature, moisture, anything that I can use the back of my hands for this. Back of our hands are a little more sensitive, so I don't feel any abnormal heat. While I'm doing this, I can go ahead and palpate. Ryan, tell me if you feel any pain or tenderness when I'm pushing, okay?
Okay.
And I'm just going to feel around. I'm listening also for any crackling or popping sounds. Go ahead and lean forward just a little bit for me. Excellent. Excellent, Ryan. So I'm listening for this popping and crackling because in the lungs, if there's going to be any air that's going to be escaping, it'll seep into the subcutaneous tissues. And when you push on that, you'll hear it popping and crackling and coming out of that. So the next thing that we're going to want to do is go ahead and I'm going to do some percussions. And I'm just going to be laying my finger there and I'm going to just be tapping. And what I hear is like a resonant sound. It's going to be a dull sound. It's going to be like a hollow sound because I'm going to be in between his rib cage. So subclavicular. You'll be in front of the camera for a minute. Okay. One more thing that I would like to look at while I'm doing this is I want to make sure that he is evenly distributed. Yep. Okay, so I'm looking to see, is this half the distance as his posterior side? And it is. If it wasn't, then... I'm doing a video. Hold on. This is so embarrassing. Okay, sorry about that. We got to do it in one run, right? Thank you. All right, so we're coming back to this now. We were not interrupted. What I was looking for on this, yes, was I wanted to make sure that he was proportionate from his rib cage to his back as he is across his back, and you want about halfway. And on some of the older adults, you'll see that it might actually be a little bit more than that, and that's normal in that circumstance. Also, what I'm looking for is to see that he's not barrel-chested, or that he's not sunken in, or that his chest doesn't protrude outward. And again, like as I stated earlier, that he was fine with that. And then I'm going to also go ahead and do some percussions in the back as well. I should probably have you turn around. Okay. Okay. And I don't want to go over the spine, and I don't want to go over the clavicle, so I'm just going to be, again, in between. Okay, and now I'm going to just go ahead and sit like that. I'm going to have you take a deep breath. And I'm underneath the 10th rib, and I just want to, you're going to watch my hands pull away. And I'm looking to see for symmetrical, if they're pulling away evenly, or is one side pulling more than the other side. It's giving me an idea of what's going on inside of his lungs. Go ahead and take a deep breath. See how my, okay, go ahead, do it again. You see how they're coming away evenly? One more. Excellent. While I'm back here, I'm going to have you go ahead, and I'm going to have you say 99, 99, 99. Every time I move my hands, I want you to say 99, okay?
Okay.
And I'm feeling, this is a test that we do to see, we're feeling for vibrations to come through, and it should be a little less and less and less as we go.
99.
And I'm feeling with the palms of my hands, not my fingers. Go ahead.
99. 99. 99. 99.
Okay, good. If it had been clearer and stronger feeling as I was going down, that would be an indication of something that we call bronchophony, which I did not feel. I'm going to do it to the front as well. So normally we would have a bed that comes up. All right. Go ahead.
99. 99.
I don't feel anything. I think we're good.
99.
Yeah, we're fine. All right. Oh man, I'm an old man now. Okay, so I'm gonna go ahead and take a listen. I'm not seeing any reason to find anything here. Or wipe this end off with an alcohol pad. I'm gonna have you turn your head. Oh, that'll work. Yep. So our lungs actually start up above our clavicle. Take a deep breath. Again. I don't hear any wheezing. Here you go. One more. Very good. Okay, and then from the back once more. Very good. So as I put this back on there again, I want you to say E, E, E. Okay?
Okay. E. 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 E.
So I'm listening for something that we call echophony, and it sounds equal as I go back and forth. I'm trying to compare the left side versus the right side, and then the right side to the left side, and back and forth as I go, see if there's any inconsistencies, and everything is sounding normal from here. And I have one more last test I'm going to do. It's going to be a whisper test. I don't know if you're going to be able to hear it. I should not be able to hear it through this. So I'm going to have you say 1, 2, 3, but you're going to whisper it so that I should not be able to pick it up through here, but we're going to find out if I do or not, okay?
All right.
So you were saying it?
Yes.
Okay, good. So I didn't hear anything. If we had, that would have been an indication for something that it's called petriloquy. I have a hard time saying that word, but there's no congestion in his lungs. There's no signs of bronchitis anywhere. There's no signs of pneumonia in any of his lobes. All in all, I'd say that this was a good visit for him. So, Ryan, didn't find anything? Do you have any questions that you'd like to go over? Any last things, anything that you can think of that possibly we might have missed, or you've been thinking of, oh, hey, I was going to say this when I was here? Nothing? Okay.
No.
Well, I think things are good. You can go ahead and put your shirt on, and you go ahead and meet the nurse up at their station.
All right. Thank you.
Yep.